What is the LPN role in epidemiology? While LPNs are not epidemiologists, they do play a critical role in applying epidemiological principles in everyday practice. LPNs use epidemiology when identifying common symptoms in the community, understanding which patients are at greater risk, choosing appropriate patient education topics. For example, knowing influenza is prevalent helps an LPN prioritize isolation, precautions, and vaccination reminders. LPNs are often the first to notice patterns because they see patient symptoms day to day, such as multiple residents in long-term care develop diarrhea. Several students in school develop a fever and rash. Increased COVID-like symptoms in a clinical setting. LPNs are essential in reporting unusual patterns, following facility outbreak protocols, ensuring accurate documentation. LPNs help reduce risk by teaching hand hygiene, reviewing vaccination schedules, reinforcing medication adherence, and explaining how diseases spread. Epidemiology guides which tests, vaccinations, and interventions are recommended for different groups. Assessment in public health. Assessment is one of the three core functions of public health. It involves systematic data collection, analysis, and interpretation to help understand the health needs within a community. Public health agencies monitor disease rates, health behaviors, environmental exposures, and emerging threats. This then helps identify the trends, such as rising flu cases, new or re-emerging diseases, health disparities among populations. This assessment guides decision-making for preventative programs, resource allocation, and early outbreak detection. LPNs contribute by accurately documenting symptoms and cases, reporting unusual clusters to support early recognition of outbreaks, and by participating in screenings and community assessments to assist in data collection efforts. Policy development uses evidence to create laws, guidelines, and programs that protect public health and promote fairness. Key concepts are policies that are data-driven, meaning they rely on the information gathered during assessment. The goal is to promote equity and to protect vulnerable groups such as children, older adults, low-income communities, and individuals with chronic illness. Examples would be a smoke-free workplace, vaccination requirements, food safety regulations, and emergency preparedness plans. LPNs help shape the policies for workplace protocols such as PPE guidelines and are responsible for following and reinforcing policy through patient teaching and clinical practice. Assurance of health services means that people have access to necessary public health services, medical care, and education. By providing the core components of access to healthcare services, health education, environmental protection such as clean air, water, and sanitation, monitoring quality to ensure services are safe and effective, and collaboration between healthcare providers, public health agencies, community organizations, and government agencies. LPNs support assurance through providing patient education, helping implement quality improvement activities, identifying gaps in access, such as the inability to afford medication, and reporting environmental or safety concerns in a clinical setting. There are 10 essential public health services. These services operationalize the three core functions: assessment, policy development, and assurance. They provide a framework for how public health systems protect communities. The 10 essential services include monitoring health status to identify community problems, diagnose and investigate health hazards and threats, inform, educate, and empower people about health issues, mobilize community partnerships to address health problems, develop policies and plans that support healthcare efforts, enforce laws and regulations that protect health, link people to needed services and assure accessible care, assure a competent workforce through training and development, evaluate effectiveness of programs and systems, and research for new solutions to health problems. The epidemiological triangle is one of the foundational models used in epidemiology to explain how disease occurs and spreads within a population. It is especially useful for understanding communicable and infectious diseases. The triangle has three components: the agent, which is who causes the disease; the host, which is who can get the disease; and the environment, which is the conditions that allow the disease to be transmissible. Disease occurs when all three components interact. The agent is the who or what factor that must be present for a disease to occur. Agents could be biological, chemical, physical, or nutritional. Agent characteristics include infectivity, which is the ability to enter and multiply within a host; pathogenicity, the ability to cause disease; virulence, the severity of the illness produced; toxigenicity, the ability to produce toxins; and resistance, the ability to survive within the environment. The host is the who, or the person or organism that can become infected or affected by the agent. Host factors that determine susceptibility: age, the very young and very old are often at higher risk; genetics; immunity, natural or vaccine-based; nutritional status; chronic disease; lifestyle behaviors; and previous exposures. LPNs assess host factors during patient history and risk evaluation. Environment, or the where, includes external conditions that allow disease transmission, such as climate and weather, crowded living conditions, clean water and sanitation, food safety, healthcare access, vectors such as mosquitoes or ticks, and social or cultural conditions. Environment can either promote or prevent disease spread. The triangle works because the disease develops when agent plus host plus environment interact in a way that allows transmission, such as in influenza. The agent is the influenza virus, the host is the unvaccinated individual with weakened immunity, and the environment is winter season with crowded indoor spaces. If you remove or control one side of the triangle, the disease can often be prevented. LPNs use the epidemiological triangle to understand how infections occur, to teach patients how to reduce risks of infection, to recognize when multiple cases may signal an outbreak, and to apply infection control practices in the clinical setting. The natural history of disease describes the progression of a disease process over time, before, during, and after clinical signs and symptoms appear, without medical intervention. Understanding this model helps LPNs recognize risk factors, identify early warning signs, and apply appropriate levels of prevention. The model is divided into two major periods: pre-pathogenesis period, which is before the disease begins; pathogenesis period, which is after a disease begins. Pre-pathogenesis period is the stage that occurs before a person becomes ill. The disease has not yet developed, but the conditions for it may already exist. Key features include interaction of host, agent, and environment; individual is susceptible but not yet infected or symptomatic; and risk factors are present. Related level of prevention is primary prevention via vaccination, hand hygiene education, healthy lifestyle promotion, and environmental sanitation. The pathogenesis period is the stage that begins when the biological changes of disease have started within the body. It includes both early and late phases. Early pathogenesis, changes occur at the cellular level, but no symptoms have yet appeared. Clinical disease, the signs and symptoms have appeared, disease can be diagnosed through tests and assessment, and illness can progress or resolve depending on treatment and the host's response. Outcomes are recovery, chronic disease, disability, or even death. Related levels of prevention are secondary prevention or early detection, screening tests and detecting disease early to prevent progression. Tertiary prevention is used to reduce complications, such as rehabilitation, medication management, or preventing disability from a chronic disease. LPNs use the natural history of disease model to identify where a patient lies in the disease process, apply the correct level of prevention, recognize when a patient is at risk and needs intervention, support early detection through screening, educate patients about reducing risk and preventing progression, and to understand why some diseases are silent before symptoms appear. The chain of infection is a model that explains how infectious diseases spread from one source to another. Breaking any link within the chain can prevent diseases from transmitting, making this model essential for infection control. The chain consists of 6 links: the infectious agent, the reservoir, the portal of exit, the mode of transmission, the portal of entry, and a susceptible host. The infectious agent is the microorganism that causes the disease. Ways to break the link include hand hygiene, proper sterilization and disinfection, and correct antibiotic use and education. The reservoir is the place where the pathogen lives, grows, or reproduces. Prevention measures include cleaning and disinfecting surfaces, safe food handling, and proper storage and handling of medical equipment. The portal of exit is the way in which the infectious agent leaves the reservoir. Interventions include covering coughs, using PPE, and proper disposal of sharps and contaminated materials. The mode of transmission is how the pathogen travels to a new host. There are several types of transmission: direct contact, involving touching or bites; indirect contact, involving contaminated objects; droplet, within 3 to 6 feet; airborne, the tiny particles that remain suspended; vector-borne, such as insects like mosquitoes and ticks; and vehicle-borne, via contaminated food, water, or medications. Interventions are hand hygiene, isolation precautions, wearing masks and respirators when indicated, and cleaning shared equipment. The portal of entry is how the organism enters the new host. Prevention is maintaining skin integrity, proper catheter care, using PPE, and safe injection practices. Susceptible host is any person who is vulnerable to the infection. Risk factors are age, such as infants and older adults; chronic illness; immunosuppression; poor nutrition; lack of vaccination; and stress and fatigue. How to reduce susceptibility includes immunization education, promoting good nutrition and hygiene, monitoring chronic conditions, and educating patients about infection prevention. Observational studies are research designs used in epidemiology to understand health outcomes without manipulating any variables. Researchers observe what happens naturally in a population instead of assigning treatments or exposures. These studies are essential for understanding disease patterns, identifying risk factors, and forming hypotheses for future research. The purpose of an observational study is to describe how diseases occur in populations, identify risk factors associated with illness or injury, compare health outcomes between groups, generate evidence when experiments are not ethical or possible. They are commonly used when studying harmful exposures, such as smoking or chemicals, following large groups over time, and investigating outbreaks. There are 2 types of observational studies: descriptive studies, which answer the questions who, what, when, and where. They describe patterns but do not test a cause and effect. Examples are case studies, case series, descriptive surveys, and community health assessments. This is used in nursing to identify new or unusual disease patterns, clusters of cases, and populations at highest risk. Analytical studies look for associations between exposures and outcomes. They answer the why and how. They assess whether an exposure is directly linked to a disease. This can include a cohort studies, which follows a group of people over time based on exposure status. You have your prospective cohort, which follows people into the future, and a retrospective cohort that uses past records. For example, smokers versus non-smokers to compare lung disease rates. The strengths, it shows the direction of the disease development and can calculate incidence rates. Weaknesses, time-consuming, expensive, and risk of loss to follow-up. The second is case control studies. This compares two groups. Cases are the people with the disease, and the controls are the people without. Researchers look back in time to identify exposure differences. An example is comparing people with food poisoning to those without to identify the foods they ate. The strengths, it's quick and inexpensive, it's good for rare diseases, and it's useful during outbreaks. The weaknesses, it relies on memory or recall bias and cannot measure incidence rates. The third is the cross-sectional studies. Exposure and disease status are measured at the same time, providing a snapshot of a population. An example is surveying adults to see how many currently have hypertension. The strengths are it's fast and inexpensive and useful for planning health services. The weaknesses that cannot prove cause and effect, hard to determine which came first, the risk factor or the disease. So why does observational studies matter for you? Even though LPNs do not conduct the research, the observational study findings directly influence the clinical practice, public health, and patient teaching. Experimental studies are research designs in which the investigator actively manipulates one or more variables to determine their effect on health outcome. This is different from observational studies where researchers only observe natural events. Experimental studies are considered the gold standard for determining cause and effect in epidemiology and clinical practice. Experimental studies are used to test whether an intervention causes a change in health outcomes, to evaluate new treatments, medications, or procedures, to assess preventative measures such as vaccines, to compare the effectiveness of two or more health interventions, and to provide strong scientific evidence for clinical guidelines. These studies are fundamental in developing evidence-based practice. The key features of experimental studies: manipulation, where the researcher deliberately assigns an exposure or treatment; the control, where one group receives intervention and another does not; randomization, patients are randomly assigned to groups to reduce bias; and blinding. Participants and sometimes researchers don't know who receives treatment, which helps increase fairness and accuracy. The types of experimental studies are randomized controlled trials, or RCTs. These are the most rigorous type of experimental study. Participants are randomly assigned to the intervention group or the control group. Groups are followed over time and outcomes are compared. This is the strongest evidence for cause and effect. It reduces bias through randomization and it's highly controlled. However, it is expensive, time-consuming, and does have ethical limitations. Community trials, instead of individual participants, the entire community receives the intervention, such as flu vaccines or public health campaigns. Community trials are useful when interventions target populations, not individuals. The quasi-experimental study is a non-randomized study that uses geography, facility assignment, or convenience to base how groups are chosen. Its strengths are it's practical in real-world clinical settings, and it's useful when randomization is unethical or impossible. However, it is more vulnerable to bias and harder to prove cause and effect. Interpreting health data means understanding basic health statistics, and it helps LPNs make informed clinical judgments. Common epidemiological measures are incidence, which is the number of new cases in a population; prevalence, the total number of existing cases; and mortality rates, the number of deaths in a population. LPNs encounter this data in community health reports, facility infection control updates, and public health alerts. Why does this interpretation of data matter for LPNs? This helps identify high-risk patients, monitor changes in health patterns, prioritize care when resources are limited, and it communicates concerns to the RN and supervisors effectively. If facility data shows rising UTIs, LPNs may focus on hydration teaching, improving catheter care techniques, and assisting in reviewing documentation trends. Frequency measures are basic tools in epidemiology used to describe how often illnesses, injuries, and deaths occur in population. These measures help public health officials and nurses understand the burden of disease, to track trends, and plan interventions. The two major categories are morbidity, the measure of illness, and mortality, the measure of death. Morbidity refers to any state of illness, disability, or poor health in population. Morbidity measures how many people are getting sick or living with a specific disease. There are two main morbidity measures. Incidence measures the number of new cases within a specific time period, and prevalence, which measures the total number of existing cases, both new and old, at a given time. Mortality measures describe how many people have died from a specific disease or injury. There are several types. Crude mortality rate is the total number of deaths in a population over a certain period of time. This shows the general likelihood of death in a population and does not account for various age differences. Age-specific mortality rate is the number of deaths in a specific age group, which helps target health programs and shows vulnerability in groups. Cause-specific mortality rate is the number of deaths caused by a particular disease, such as lung cancer or heart disease. These measures help interpret public health data, guide clinical priorities, support patient education, identify vulnerable populations, and inform prevention strategies in facilities. Screening identifies disease before symptoms appear. Epidemiology determines who should be screened, how often screening should occur, whether screening is cost-effective and beneficial. Examples include blood pressure screening for hypertension, Pap tests for cervical cancer, NTB testing in high-risk populations. Prevention strategies. Epidemiology supports prevention at all levels. Primary prevention prevents disease and is done with vaccinations and education. Secondary prevention detects diseases early, such as with screenings. Tertiary prevention reduces complications. Rehab, medication management are examples. Data helps decide whether vaccination programs reduce disease, if a new health education improves patient behavior, and whether infection control practices lower infection rates. An outbreak occurs when the number of cases of a disease is higher than the expected in a particular place or time. Public health teams follow a systemic investigation process to identify the source, stop transmission, and prevent future cases. LPNs play an important role by recognizing unusual patterns, reporting cases, and helping implement control measures. Before an investigation begins, public health professionals confirm the number of cases is greater than normal. This is done by review surveillance data, compare current cases to baseline levels, confirm diagnosis with labs or clinical assessments. Investigators ensure correct identification of the disease by reviewing clinical findings, laboratory confirmation, and interviewing patients. Investigators then develop a case definition, which includes person, place, time, and clinical criteria with symptoms or labs. Types of cases are confirmed, probable, or possible. Investigators then describe the outbreak using time, place, and person. They identify patterns, determine how the disease is spreading, and form an early hypothesis. A hypothesis then suggests how the outbreak started and how it's being spread. Investigators use analytical studies, environmental sampling, and laboratory analysis to test hypotheses. This is done to confirm which exposure is linked to the illness and rule out other causes. The next step is implementation of control and prevention measures. This step often begins before the investigation is completed to help reduce illness. Public health teams then communicate the findings to healthcare facilities, community partners, government agencies, and the general public. This helps improve future prevention and preparedness. Ethics in epidemiology refers to the principles and moral guidelines that protect individuals and communities while collecting, analyzing, and using health data. Because epidemiology often involves patient-level data, sensitive health information, and disease surveillance, ethical standards ensure that the public health actions remain fair, respectful, and responsible. For LPN students, that means understanding these principles that reinforce why confidentiality, accurate reporting, and respectful care are essential in both clinical and community settings. Respect for persons or autonomy is the principle that ensures that individuals are treated with dignity, given clear information, and allowed to make their own decisions about participating in studies or public health programs. The key components are informed consent, voluntary participation, and the right to withdraw. Beneficence and non-maleficence are the principles required by researchers and public health professionals to maximize benefits and minimize harm. In epidemiology, this can mean avoiding unnecessary testing, ensuring interventions do more good than harm, and protecting communities from false alarms or misinformation. The principle of justice and equity ensures that the benefits and burdens of public health research and interventions are shared fairly, meaning that no group is unfairly targeted or excluded. Confidentiality and privacy of epidemiological data often includes sensitive health information protection. By protecting this information, this means you are keeping the ethical requirements of keeping personal data and information private, sharing only necessary information for public health action, and using de-identified data whenever possible. Researchers must remain transparent and honest and communicate findings clearly. This includes avoiding manipulation of data, reporting errors and uncertainties, and sharing results with affected communities. Sometimes protecting the public may require actions that limit individual freedoms, such as quarantine, isolation, or mandatory reporting. This is an ethical balance because actions may be necessary, proportionate, and evidence-based. It is a least restrictive measure to be used first, and communication should remain respectful and clear. Public health professionals must maintain high ethical standards, avoid conflicts of interest, and prioritize community well-being.